Good afternoon.
So your name, designation, and your organization's name for the camera, sir?
And I'm Dr. Sharan Patil, Chairman, Founder, and Chief Orthopaedic Surgeon of SPARSH Group of Hospitals in Bangalore.
Thank you, sir. So how are you feeling today?
All good. Yeah.
Yeah. And how are you enjoying the event, sir?
It's been a good experience. It's been very thoughtfully put together, so I'm enjoying the sessions. Yeah.
That's great, sir. So my first question for you today, since Sparsh has opened a new hospital recently, what are the check boxes, what are the tick boxes for a good hospital in today's date? And do you also plan to move out of Bangalore for your next hospital, sir?
The most important thing is to be able to onboard very good talent, may it be nursing, doctors, administrators. Putting a fabulous team probably is the most important thing. Equipment and machinery goes without saying, and by and large, a hospital needs to be comprehensive enough to meet all the needs of the patients rather than sending them outside the hospital for anything. Of course, we are looking at stepping out of Bangalore, but we have a vision of geo-mapping the city of Bangalore in an effective way and able to service the population which exists in Bangalore with our brand of healthcare. And that's our first goal. And once we do that, when we perfect that, we certainly will move out of Bangalore and reach out to the rest of the country.
Thank you, sir. So my next question for you today. So what expectations do stakeholders have from Budget 2026 regarding increased funding for healthcare infrastructure and workforce development?
Certainly, there's a lot can be done. And to start with, I would say the equipment and machinery, what we use in the hospitals, is by and large imported. I would say almost 80% of the high-end equipment, the MRIs, the CT scans, everything comes from outside the country. And it attracts a significant amount of duty. By the time it reaches the hospital, invariably the organizations have to charge to the patients. So it makes the healthcare that much more expensive. We can certainly look at how the cost of importing can be decreased. Even more importantly, how Indian manufacturing companies can give that same quality or even better quality and manufacture it in our own country, which avoids the unnecessary cost, will be a great way forward. I would urge that Make in India as a concept which has come up needs far more emphasis. And hospital should be treated slightly differently. If the government is serious about reducing the cost, certainly right from the electricity bill to the water supply bill, there is absolutely no subsidy from a commercial organization. Well, hospital sector, we say, end of the day, it is a service sector where we service the people and one needs to be humane about it. But if it is treated completely like any other commercial establishment, it becomes very difficult to subsidize healthcare in any way. So I would urge that we need to look at hospital sector slightly differently.
All right, sir. So as a person who owns an healthcare infrastructure, owns an hospital, sir, what are the biggest challenges you faced being on the position you are?
Healthcare, it requires a lot of skilled talent. And when we are talking about skilled talent, we have people getting educated, whether doing their postgraduate courses as doctors or nurses qualifying. The skill are not ready for life, still not ready to work in the hospitals. So to be able to get them ready from education to real life situation, there is a big gap in our country. So I think that finishing school, that training, even the methodologies in the education institutions need to change to make a bigger health force available for us. Our hospital need soft skills as much as technical skills, and that kind of a trained manpower is so important for us to progress further. And I think there is a lot of room for us to develop that as a country.
Thank you, sir. That's all.
Thank you.
Thank you.